Good morning. Thank you, Arup, for putting me in. Well, in the next few minutes, I'm going to talk about a different approach to conquer moderately hard cataracts. Well, we all know by now that these hard cataracts typically has a thin capsule, a little cortex, or maybe very little or no cortex, and 3 layers of nucleus. There is a thin epinucleus, a firm inner nucleus, and a hard amorphous central core. Well, as you have just heard from Dr. Shubin, that there are many ways of chopping a hard cataract, but by far, vertical chopping is the one that is recommended. Well, let us also understand that conventional techniques of chopping still remains challenging for brunescent cataracts. Now, looking at, why I put this picture is because this is, this is how we do our conventional nucleophractis. And in this method, what happens is we use the radial suture lines as the cracking areas or the cracking zones. But the method that I'm going to describe now involves a different focus, a different concept altogether. Here, we try to actually separate the outer lamellar structure, which is loosely adhesive to the, it has loose adhesion with the central hard core of the nucleus. And that is what we want to separate. And then it becomes very easy to emulsify the hard core and then take up the loose lamellar structures. This is just an animation to show how we go about it. Once we create a number of small radial cracks, and these cracks do not reach the posterior plate, but then it loosens up the central amorphous, hard core of the nucleus, which can be easily emulsified, and then by lateral separation, we extend the lateral cracks posteriorly and then emulsify each piece at a time. Well, let's now see how it goes in real life. The nucleus is impelled with the phaco tip, and with a sharp chopper, a vertical chop is made, thereby it initiates peripheral cracks, and we repeat this procedure to create about 5 to 6 such cracks in the periphery. Well, this computer is going slow. Well, what happens is these cracks really do not reach the posterior plate, but they create a lotus petal-like appearance, and thereby separating and exposing the central hard core of the nucleus. Now, this hard core of the nucleus, as you see, can be very easily emulsified within the bag. This actually reduces the collateral damage of, the thermal damages that emanate from the high use of phaco energy. Well, now gradually what happens, these cracks which are created earlier are to be extended to the posterior plate by lateral separation using the phaco tip and the chopper, and then each piece can be individually emulsified. Well, after this, I'll go ahead. Now, what I mean to emphasize is this is a very simple technique, but then it is universally applicable, even in compromised situations. Now, this is one situation where you can see there is a subluxation, but once we stabilize the bag with capsular hooks, we involve the same technique here. You can see that we are creating lateral cracks, peripheral cracks, multiple cracks, and then we loosen up the central amorphous core. And once this central amorphous core is taken up, it's emulsified, we get a lot of space within the bag, and then we can laterally separate each of these cracks to take them to the posterior plate. Here, I would like to emphasize that this separation can be done at 2 planes. We can stop and then go deeper and then separate again. Well, after this, we can easily implant an IOL, but then I skipped that part. We also put in a CTR. Well, as I said, we can use this technique in many, many more compromised situations. Here, if you can carefully notice that there is a runaway rhexis to the periphery, and even in this situation, sometimes we are scared to, go ahead with the lateral separations. But I want to emphasize that this technique is so safe, even in a runaway rhexis. You can go ahead with this technique, make multiple peripheral cracks, and then separate them peripherally after emulsifying the central core of the nucleus, and that actually gives us a lot of space. And then you can emulsify each piece individually. And at the end, I'll just show you that, well, if we go ahead, you can see that even lateral separation doesn't cause any harm to the runaway rhexis there. We complete this procedure slowly, but of course very slowly. Here again, there is a two-stop separation, two steps separation. We can go deep and separate the layers to take the crack to the posterior part. And here it is, this is the runaway part, but it did not extend posteriorly. Well, there are certain distinctive advantages of this technique. There is very minimal stress on the zonules. There is very low vulnerability of the posterior capsule. And the most dense inner part of the nucleus is emulsified within the capsular bag, thereby reducing the chances of ultrasound-related complications. Of course, we don't need a very new technology or instrument to learn and practice this technique. And this method of emulsification has shown consistent outcomes for moderately hard cataracts. Thank you.